Katie here on the social media team. With me I have Betsy Martin, clinical RN on the nursing division. Today for this clinical corner, we're talking about nurse bullying. What exactly can be done about it?
Well, I think a really important piece is education and awareness, kind of like how we're talking about it right now. People need to be able to recognize what bullying is. So again, it involves an imbalance of power in addition to repeated negative behaviors. So we all need to be aware of that. The Joint Commission actually requires its facilities to have anti-bullying programs, preferably zero tolerance programs. So they need to be able to show that their employees are aware of what bullying is, so have real examples of it. Also, they need to know what the consequences are if they choose to engage in that type of behavior. And then the facilities need to follow through on those consequences too.
Yeah, absolutely. So it sounds like a big part of it is education.
It is, yeah. And some facilities are better than others. So, obviously we want to make a healthy, safe culture in as many facilities as possible.
So, you talk a lot about if a nurse feels comfortable approaching the nurse that's bullying them, to definitely do that, and that's super important. But if that nurse doesn't feel comfortable approaching the other nurse, should they notify management, or what steps should they take?
Yeah, I would definitely encourage them to notify management. And, like we said earlier, bullying is very underreported, so we need to get better about reporting it. And even though you might not get the resolution that you want right away, at least it's being documented, because like I said before, bullying is repeated behaviors, so you want to have that documentation in real time.
Awesome. Well, thanks so much for joining us today, Betsy. We really appreciate all your knowledge. Viewers, thanks so much for tuning in. If there's any additional questions that we didn't get to, please don't hesitate to reach out. We'd love to be an additional resource for you. Thanks so much.